Welcome to our practice. We are woman-to-woman gynecology and all women care. We're a women's health clinic providing regular gynecologic services and a discreet abortion clinic offering boutique family planning services. Our doctor is a woman. She is a Las Vegas gynecologist with over 20 years of clinical experience. She has been the recipient of multiple patient care awards. You will be in good hands. When you arrive for your appointment, you will complete paperwork about your health and provide us with general demographic information. We will ask you for your insurance card, if you have any, in the event outside laboratory work is needed. Being thorough and truthful is very important as your safety is at stake. You will meet our medical assistant who will review your paperwork, answer your questions, and take your blood pressure, temperature, weight, and height. We will request your pharmacy and emergency contact information for your electronic medical record. We will draw your blood to find out your blood type. This is important because should your blood type be Rh negative, you will need a vaccination with a medication called RhoGAM to prevent serious complications in future pregnancies. We will then perform a pelvic ultrasound. During this evaluation, we check the uterus, the ovaries, the cervix, and the location of the embryo. We also confirm how far along you are. In addition, we exclude the presence of an ectopic pregnancy, which is located in places such as the cervix, the fallopian tube, or the abdomen. An ectopic pregnancy can be very dangerous and may require medical or hospital surgical treatment, which is different and more involved than a routine pregnancy termination at the office. We will start an intravenous access line, commonly known as an IV. Through it, we will give you medication that will make you comfortable and relaxed. For your safety, we will place different monitors on your arm and finger that will measure your blood pressure, your oxygen level, and your heart rate. This is done throughout the surgery and the recovery period to make sure that you're safe and sound. When you are comfortable and relaxed, we will give you a local anesthetic on the cervix. When the cervix is numb, we will gently open it with instruments called dilators. We will then use a suction machine to perform the pregnancy termination by evacuation. We call this a D&E, which means a dilatation and evacuation. The suction catheter is placed in the endometrial cavity gently and carefully, removing the pregnancy and its attachments and leaving the uterus clean and empty. Some cramping may be expected during this time, but it is quickly gone once the procedure is completed. The entire procedure lasts about 5 minutes. You are then no longer pregnant. You will be transferred to the recovery room where you will stay for about 20 to 30 minutes. The medical staff will monitor you and make sure that you are well and ready to go. We will go over your instructions, your prescription medications, and your follow-up appointments. Before your departure, you can choose the method of birth control you desire. You can have birth control pills, the Depo-Provera shot, condoms, the patch, the Nexplanon, and 3 different types of intrauterine devices, or otherwise called IUDs. The placement of the Nexplanon or IUDs will be done at a separate visit, and they have different costs. If you have insurance that covers them, we will authorize the contraceptive devices for you, obtain them, and call you back for placement. We will see you back in 3 weeks. We want to make sure that all went according to plan and that you are well. During this visit, we can discuss more about the birth control methods that fit your lifestyle best. You can also have your annual exam along with your pap smear and testing for sexually transmitted diseases. These services are at an additional cost, but they are offered at discounted prices to patients who had the pregnancy termination in our office. Life will go back to normal again, and we will need to see you only on an annual basis for routine well woman visits. Dating and being sexually active can resume for as long as you have effective contraception and STD prevention. Success. Well done.